Hello and welcome to the fourth and final part of our video series on PNH treatment. I'm Dr. Panse, a hematologist from Aachen. In the previous clip, we talked about medications, and today we'll look at something just as important. What is the goal of your treatment, and how do we know if it's working? With PNH, it's not just about normal lab values, it's about how you feel in everyday life. How do you feel overall? Are you becoming more resilient again? Has your quality of life improved? Treatment goals in PNH are always individual, and they should fit you and your life. Of course, we look at important blood values, for example hemoglobin, which tells us how much blood pigment you have, or LDH, which shows how strongly red blood cells are being destroyed. But numbers alone never tell the full story. That's why we need more than numbers. We need your personal experiences, and the best way to track them is to regularly note how you're feeling, for example with a symptom diary or an app. What exactly should you pay attention to? For example, do you suddenly feel more tired than usual? Do you have new abdominal pain or trouble swallowing? Is breathing becoming more difficult? Sometimes these are signs that your treatment is no longer working optimally, or that a so-called breakthrough episode may be beginning. A breakthrough episode is a phase in which symptoms suddenly reappear despite treatment, because the immune system temporarily overcomes the medication. This can happen if you have an infection, develop a fever, or if medication wasn't absorbed properly, for example due to vomiting or diarrhea. That is why it's so important not to wait when something changes. Even small changes can mean that your treatment needs adjustment, and that is only possible if you inform your doctor early. Monitoring your treatment doesn't just mean checkups at the clinic. It also means reflecting together. What was your goal at the start of therapy? And today, are you closer to that goal? For some people, that means being able to work again. For others, having more energy for family life. That is the real power of regular monitoring. It's not control in the sense of being checked on, but support, like a navigation system that helps you stay on course and warns you if you drift off the path. So here's my message: stay active, document how you're feeling, and don't hesitate to reach out to your medical or nursing team, because in the end, it's about you and your life with PNH. Thank you for accompanying us through this series. I hope you were able to take away helpful insights for your treatment, and most importantly, that you feel empowered to actively shape your life with PNH. All the best, and see you soon.